medicine practice. Medicine means including surgery, everything. It needs a teamwork. So your study should be a teamwork. You have to realize tomorrow will be your oath-taking ceremony, and please be in team and partners, whatever it is you feel comfortable with. You have 750 hours of anatomy teaching in the classroom, in the lab, in the dissection hall. So you take a oath that we will maximum time we will utilize in the department also. And after dinner at 10 p.m., you please study anatomy, whatever content you want to study, and the lectures which is being carried out, you please together you sit down, take a book, take an atlas, and you interact with each other. You practice for 1 month, my formula, and you see you are gaining or not. And if I am wrong, you tell me. I want to learn from you. I want the feedback that you are not improving. Please do it. Otherwise, the performance was not bad. But anyway, the system has become easy of the examination and also the histology practical. See, there were 5 slides, 2 marks each. So you identify, and whatever you give 1 or 2 identification points is remarkable. Like you do see kidney is the glomerulus apparatus. But 1 identified point. So you can write 2, 3 points, and what is the slide given to you. So I gave 10, but on the second day, most of they have identified. So, but one thing is to be noted, that blindly, if anyone says, "No, it is liver ache," but liver was not given. It is thyroid ache. A fish. You do fishery, but you see if your friend has told you the correct. You get my point? Now, I want to tell you that whatever you are seeing, whatever you are, you just cross-check yourself. This is with this small feedback or post-mortem of the practicals which I were present. So, you start from today only. Tomorrow, no. I won't leave it, don't leave it for tomorrow. Kale peye jabe. Then Kal doesn't come back. So now see wrist joint. Now what I have drawn, you just come and see. I don't know the last benchers if they can see it, but I would suggest you see the arrangements. Like there was an articulated foot. There was an articulated hand. And the day I took osteology, the upper limb. Now, if I'm telling femur, tibia, those things are gone. I have asked, but again I tell him that you take up the foot or take up the hand, articulated hand. Now, no, sir, put it. Actually, I asked them that just name the bones comprising the foot, bones comprising the hand. Many of them could not answer. Ami kintu bulchina, there is a pattern that you go from right to left or proximal to distal. Now, With this is a drawing of the hand. See the bones, hamate, capitate, trapezoid, trapezium, pisiform, tracral, lunate, scaphoid. This is the ulna and radius. Now, the proximal row, you can see the triquetral, pisiform, lunate, scaphoid, and the ulna and the radius. Now, similarly, over here, you see the hamate and the capitate, the trapezoid and trapezium. এটা তোমার এটা ধরো if the wrist joint comes now, or this mostly you can recollect and represent, and similarly এটা কোথায় নেই? Okay. Now, this is the diagram taken from Grant's textbook. If you can find it, I don't know this edition is in the net or not. You can see it, or again when you are in the practicals, you just take the pictures and you take the articulated hand and the articulated foot. I will give you a key, like similarly. Now the articulation, now distal end of the radius and the articular disc, ellipsoid and concave surface. Scaphoid, lunate and triquetral, ellipsoid and convex surface. Now, if the wrist joint, the wrist is concave, the radius is concave. Now, it has to form the joint. So, the small bones, the scaphoid, lunate and triquetral are ellipsoid in the surface. So, they can glide, they can fit, and see there are the movements, the movement, rotation, flexion, extension. Now, these are the very minor movements are there, and intricate. The anatomy of the hand. See, it is a wonder tool, I would say. If like you drawing, the artist or the painting from Rajasthan, miniature paintings or anything, you are doing, you're an ophthalmic surgeon, you are under microscope, it's become easier, but your precision, your hand has to be used. There is no machine or robot now to do a robotic surgery or in ophthalmologic practice. So you have to give a foldable lens. You have to make a small incision, and that you have to put the hand. So the minor movements of the hand. I am very protective about my hand. When I'm traveling, I used to travel in general compartment and 3-tier. If there is a rain, I used to ask my co-passenger, please put down the shutter, window shutter, because I always in a panic of losing my hand, because in '86 I got a bad infection of my thumb, right thumb. This is disfigured, and there was no antibiotic or so. 84, and it got swollen up. I had a cocktail of pethidine, Campos, but still I could not sleep. So you can see the mind controls the brain, or the brain controls the mind, you don't know exactly. So please protect every organ you have to protect. Similarly, hand is such a instrument that you have to take extra care. And with hand, see a blind person, stereognosis, he can feel you like this. And see, you are Juliet. Your eyes, hey, আমি কে বলতো? Hey, তুই Rahul. So your hand gives a touch, that sensation and that feeling. And these are the small muscles in the hand which control everything, and they originate in the palm. There are some interossei and umbilical muscles when you go on, but from here you know that you have read the tibia, the humerus and the radius and ulna. Now the extensor group and the flexure groups of muscles are there. Now similarly, here is the hand. A dissected specimen showing the dorsum of the hand. Now articulation, type synovial ellipsoid joint. Synovial ellipsoid joint, capsule enclosing the joint includes the articular disc. Now the articular disc there, it encircles. I showed you the first lecture on the types of joints. And so just recollect. Now, ligaments, anterior and posterior radiocarpal ligaments, the medial ligament, styloid process of the ulna and the tricuspidal bone. If you see the bone there, tricuspidal here. Now, the lateral ligament, styloid process of the radius and the scaphoid bone. See the styloid process of the ulna. This is the radius. This is lateral ligament. This is the medial ligament. This is styloid process. So they're like in the knee joint, the tibia and the knee, femur, they articulate. So medial, collateral, lateral, collateral ligament. Similarly, lateral ligament, medial ligament. This is a comparative because we were with the evolution of erect posture. Now from quadrupeds we have evolved, and naturally the hands became catching the branches. You see the gorilla and the monkey in Animal Planet. You see their behavior. You watch when you are bored, you are not feeling like, don't go for Facebook. You see, you will enjoy. Okay? Now, synovial membrane lines the capsule. The joint cavity does not communicate with distal radioulnar joint or the intercarpal joints. This is a capsule line. This does not communicate with the distal joint cavities or does not communicate with the intercarpal joints. Now movements, flexion, extension, abduction, adduction, circumduction. Circumduction is this, cricketer. Or now, why I'm telling you, a little injury to the wrist, a small injury, any part of the body gets injured, either your face, you get mutilated. There are 46 muscles in the face, 46 muscles that gives you the different your facial expression. So if there is some, like you perform a surgery on the face, then you have to, of course, there will be bit scar will be there. That means scar can be in the heart also, and also any injury in the other parts of the external surfaces of the body, and also the scars that is healing in the organs also. Now movements, see, now the movement is flexion, flexor carpi radialis, the flexor carpi ulnaris, and the palmaris longus, assisted by the flexors of the digits. Extension, extensor carpi radial is longest, extensor carpi radial is brevis, and the extensor carpi ulnaris, assisted by extensors of the digit. Now, when you go to the dissected specimen to the your dissection hall, you please see the muscles and open your dissector, and then it will be very easy for you. তোমার flexor carpi ulnaris, naturally will be in the other side. Flexor carpi radialis will be. Now what I want to see, you একটা করে tendon দেখে নিলে। The medial to lateral, lateral to medial, whatever you're comfortable with, you do it. Okay. তার জন্যই বলছি যে you crowd, you stand on the bench or your sitting stool. Naturally, you don't see exactly what you are. You cannot view. You have to go forward, closer. And that's why after the teacher tells you that this is this, this is this, সেখানে তোমাদের মধ্যে যারা ফ্রন্ট রোতে আছে তাদের মধ্যে যে একটু ভালো পড়াশোনা করছে তাকে জিজ্ঞেস করে দেবে। আর শেখার কোনো বয়স নেই, আর শেখার কোনো ছোট না বড় না ও বেশি জানে, এই ব্যারিয়ারটা ভাঙো, ইগো। তাহলেই দেখবে তোমরা দুজনাই উভয় পক্ষে, ধরো ও একটা আমি ভালো ফার্স্ট হচ্ছি, তো ফার্স্ট হওয়াটা কিন্তু ক্রেডিট আছে নিশ্চয়ই, কিন্তু সে ফার্স্ট হলো কি করে সেটা দেখা যাবে তার থিওরিতে প্রচুর জ্ঞান। তারপরে দেখা গেল সেই প্র্যাকটিক্যালতে মডারেট, কিন্তু তুমি আবার দেখা যাচ্ছে তুমি ডিসেকশনে বা ডিসেক্টেড স্পেসিমেন দেখে তুমি অনেকটাই আরো একটু বেশি। So you don't hesitate to look into the book. বছরের শেষে যখন তুমি পরীক্ষা দিতে যাচ্ছ তখন তাড়াতাড়ি কি হলো রে, কি বলছে রে, কি হচ্ছে, তো সেটার উপর নিশ্চয়ই ডিপেন্ড করবে। আমিও করেছি, কিন্তু আমি যেটা বলতে চাইছি ডিসেকশন হলে যে স্পেসিমেনটা থাকবে ওই আধ ঘন্টা দেখে নিলে বেরিয়ে চলে গেলে ব্যাগ কাঁধে, ডোন্ট ডু ইট। ওকে, ইউ সি ইটস অল দেয়ার, ইটস অল দেয়ার। কারণ সে ইউ একটা রেস্টে কাট ইঞ্জুরি, এখন তো চমকানোর দিন, ফেসবুকে দেখিয়ে দিচ্ছে নাইফ দিয়ে কাটছে, আমি কাটছি, হ্যাঁ, তারপরে সে দেখা গেল এখানে টেন্ডন যে আছে, হ্যাঁ, এই যে টেন্ডনগুলো সরু সরু, সে টেন্ডনের একটা টেন্ডন কেটে গেছে। তাহলে তোমার কাছে যখন আসবে, তুমি হ্যান্ড সার্জন, ইন ফিউচার হ্যান্ড সার্জন, তাহলে তোমাকে তো একটা ইনফিউশন দিতে হবে, তোমাকে তো আইডেন্টিফাই করতে হবে। সো ইউ ক্যান ডু ইট ইন আন্ডার লোকাল xylocaine block, local anesthesia, and also if there is an anesthetist available, then the the brachial plexus, there you can block and it will be anesthesia आधा घंटा 45 मिनट में हो जाएगा। So now if the incision is like this, you make a big incision like this, big, বড় করবে, কারণ টেন্ডনটা কি হচ্ছে ছাট করে কাটার সময় স্লিপ করে যায়। So you have to bring in those two tendons, two ends, and suture. There's a pattern, you suture. Now see, movements, abduction, flexor carpi radialis and the extensor carpi radialis longus and brevis. Adduction, flexor and extensor carpi ulnaris. The circumduction, horizontal rotation. Now the examiner might ask you, show me abduction, adduction, or flexion, or circumduction. So you must know that what is circumduction. Even you describe the wrist joint, and also the different types of movements. Now, applied. You see, this is the most common fracture. Now, college fracture with displacement or without displacement. Now, displacement আর বলবে হাত আঙুলগুলো নাড়াতে থাকে। এবার মজা হচ্ছে এরকম হয়ে থাকে তো। Now, it is like this. So, once it is reduced, without anesthesia, once it is reduced, then you will see the curvature become straight. আঙুল নাড়া তো একটা পেন থাকে ligamental stretches, the ligaments are in stretch condition. Naturally, you now once it is that it is released, once it is released, then the pain goes. Okay. Trochlear notch of the ulna, head of the radius, radial notch of ulna. Now, তোমাদের তো বোনস হয়ে গেছে তো তাহলে বুঝতে অসুবিধা নেই। Now, articulating surfaces. Upper articular surface, the capitulum and the trochlear of humerus. The elbow joint comprises of three bones. One is the humerus, the radius, and the ulna. So, describe it's a long question, 10 marks. Describe your elbow joint with action, and they might ask you on your applied also. Okay. Now, জয়েন্টের যে ফার্স্ট ক্লাসটা দিয়েছি আমার বক্তব্য হচ্ছে তোমাকে এটা পড়লে মুখস্থ করতে হবে, কিন্তু তখন যখন if you are following the main of this building. Now the building is built with bricks, concrete. Okay. Now concrete is stone chips, rod, and cement. Similarly, যখন description গুলো থাকছে সেই main what are the different types of joint from general anatomy, you just read. This is the type of joint. Now, atypical joints যেগুলো আছে এই syndesmosis, এইখানে তোমার sternum clavicular joint, এগুলো জিপি স্টার্নামের সঙ্গে স্টার্নামের জিপি স্টার্নাম জয়েন্ট, এই যে জয়েন্টগুলো আছে সেগুলোর সঙ্গে তাহলে সেটা একদিকে ডান দিকে ভাগ করেছে, আর বাঁ দিকে তাহলে সাইনোভিয়াল জয়েন্ট। এবার দি কার্টলেজ, এবার কি হবে? নাও দি surfaces of the articulating bones, their shape and the type of movements they'll conduct will give shape to the cartilage. Okay, like in the wrist joint, there was the ellipsoid joint between the radius and ulna with the upper bones. Now, similarly, the knee joint, even if you see the lower end of femur and the upper end of tibia, their surfaces, when you will be reading the lower limb, you will see the surfaces and the contour. Even though I expected I'm straight now, but it will be bow-legged somewhere. That means the cartilage will be accordingly molding during growth. Okay. Now, see the articular surface of the your humerus and the radius. Now, key function করবে, কতটা mobility হবে? এবার যেমন shoulder joint, এটা কি? It's a joint which has greater mobility. Hip joint also has mobility. Okay. Now the fibrous capsule. Joints will have capsule. Now the envelopes the joint completely, thin in front and behind, thickened at the sides. Now সামনের দিকে thin. Posteriorly enclose the joint completely, thickened at the sides, thin in front and the behind, but thickened on the sides. Thickened, with some important structures there. Now, fibrous capsule attached along a continuous line at the lower end of the humerus, includes all the three non-articular fossa. Now, the fibrous capsule is including the three non-articular fossa. Includes and excludes the epicondyle. Now, it excludes. মানে হঠাৎ তুমি খুব ভালো বলছো, তা তোমাকে একটা এক্সামিনার বললো তাহলে ফ্লেক্সার এন্ড এক্সটেন্সর গ্রুপের ওগুলো কি কাভার্ড হয়ে যায়? নো. Why? Because this creates the movements of the arm, forearm, and also the wrist and the hand. এখানে যদি থাকে তাহলে এক্সটেন্সর ফ্লেক্সার দুটো জায়গা থেকে উঠছে, তো সেটা তো রেস্ট্রিক্টেড হয়ে যাবে। ঠিক আছে, এবার কথা হচ্ছে যে if there is some infection, so swelling, if it is included in the joint, then it has the functional component of the joint is jeopardized. If it happens to be that, so এটা তোমার মাথায় রাখতে হবে that it excludes the epicondyle, distal A attached to margins of trochlear notch and blends with the annular ligament. Now the annular ligament of the radius, ওখানে blend হয়ে যায়। Now see fibrous capsule, you can see the green line. This is the green line. This is the olecranon process, and this is the head of the radius. See how it is going. So your mobility is there. It is not fixed. Okay. Ulnar collateral ligament. Is ulnar collateral ligament. Now triangular in shape, apex attached to the medial epicondyle of the humerus. Base attached to the cornoid and olecranon process of the ulna. Here. Ulnar collateral ligament. Anterior part front of the medial epicondyle of the humerus. So it is always leaving aside the extensor and the flexor and the epicondyle. Epicondyle ke chhede ye korche, includes korche. Okay. Now posterior part back of the medial epicondyle of humerus, medial margin of the olecranon process. Inferior part oblique band extends between olecranon and cornoid process. Now see the radial collateral ligament, triangular in shape, extends from lateral epicondyle of humerus, and below it blends with the annular ligament. Stability of the elbow joint. The ulnar collateral ligament, radial collateral ligament, and trochlear of humerus fitting into the corresponding notch of ulna. The trochlear, now there's a very common fracture, especially in children. Is the your fracture of the elbow. Now It was a day when the children, they used to climb trees, they used to swim, they used to play in the mud. So they fall from the tree during summer holidays, mango and jamun and everything is there. They used to go into the gardens. হ্যাঁ তো এই একটা কমন ফ্র্যাকচার ছিল এখন তো অপারেটিভ ট্রিটমেন্ট আর এর মধ্যে দেখবে ক্যারিং অ্যাঙ্গেল বলে একটা কথা আছে তো সেগুলো এই ক্যারিং অ্যাঙ্গেলগুলো it helps to carry weight without affecting the movement. Okay. And so that is lost in the fracture of the elbow. When it is set, especially in those days, but nowadays with operative orthopedics and different thing, you get a prosthesis. Now that is upgraded. Now previously there was no C-arm. So it was due to only with clinical knowledge you have to reduce the fractures mostly with tractions and all this. But if there's a fracture of the hip, neck of the femur. Now it depends what type of operation is there you have to conduct. It is now modern orthopedics. There is prosthesis. তো 4 দিনের দিন থেকে ওয়াকারে করে হাঁটছে ঠিক আছে that's marble staying but in those days Thomas's bed knee split একটা এত বড় এই কোমর থেকে একবারে পা অবধি একটা স্টিল ফ্রেম ইজ লাইক দিস ওয়েট হ্যাং করছে তার মধ্যে স্ট্র্যাপ করা আছে আর তার বেড শোর হচ্ছে ইয়ে হচ্ছে তাকে বেড প্যান দিতে হচ্ছে আর বেড প্যানস আর নট অ্যাভেলেবল অ্যাজ the online or whatever it is, also any store in the small town. তো ওটা তখন সেইভাবে হ্যান্ডেল করা হতো তো ঠিক আছে এবার দেখো now relations of the elbow joint this is a very important picture this is very important you see elbow joint যদি 10 marks এর কোয়েশ্চেন থাকে তাহলে এই ছবিটা মাস্ট আর জয়েন্টের যে ক্যাপসুল লাইনিং the ligaments এতে তুমি অনেক কিছু পাবে ইনফরমেশন now see the radial nerve and extensor carpi radialis brevis and common extensor tendon and this is the head of the radius this is the trochlear surface and you see the common flexor and the flexor carpi ulnaris the medial, the cuttage of the joint capsules, this is the cuttage, tendon of triceps, anconeus, nerve to anconeus, and posterior deviation. Now triceps muscle. So biceps, so it is just now bursas in relation to the elbow joint. Now subtendinous bursa. Below the tendon, subtendinous, and surface of the olecranon process, subtendo-olecranon bursa. Between biceps and radial tuberosity, bicipito-radial bursa, you see the bursas over here. Subcutaneous bursa between skin and posterior surface of the olecranon process. Sometimes this bursa actually swells up due to some occupational, this thing, constant some rubbing or something like that. Sometimes don't go for surgery immediately. It will palliative treatment. But if at all you have to exercise, you have to decide how much to exercise and how much to keep. Okay. Now movements of the elbow joint. Now flexion. Now chief flexor is brachialis, chief flexor. Now biceps brachii acts when forearm is supinated. Okay. Now biceps brachii acts when supinated and brachioradialis acts in the mid-prone position. Now extension, triceps, chief extensor. Eta biceps, flexor, extensor. Now Anconius assists in extension. Now Salman Khan's biceps are more or Hrithik Roshan? No, Shah Rukh Khan. Kar biceps beshi? Mota? Salman to noy. Hrithik Roshan. Now you see the carrying angle which I spoke of, elbow extended and forearm supinated. Obtuse angle between the arm and the forearm of the lateral carrying angle. Side is called carrying angle. Useful to carry objects grasped by hand. Medial edge of trochlea projecting below lateral edge. Angle obliterated with flexion of elbow or pronation of the elbow. This is the carrying angle, maybe a short note of 5 marks. Okay, just carrying angle. So you draw a picture like this and you see, describe what is it. Clinical anatomy, supracondylar fracture of the humerus, tennis elbow, lateral epicondylitis, pain and tenderness over lateral epicondyle, injury to lateral collateral ligament, injury to common extensor origin. And golfer's elbow, medial epicondylitis, pain and tenderness over medial epicondyle, injury to common flexor origin. এবার কি একটা টেনিস খেল এখানে কেউ পেইনগুলো দেখবে ব্যান্ড নিয়ে কেউ ব্যান্ড একটা ছোট ব্যান্ড ইলাস্টিক ব্যান্ড দিচ্ছে বাট ডোন্ট বি সেইং দের ইউজ একবারে 6 মাস 1 বছর আর হঠাৎ পেন হচ্ছে সে বাড়ছে হ্যাঁ একটা এবার টেনিস সে খেলে না আবার গলফারও খেলে so it is some occupational hazards are there and that gives to these two terms because mostly it was the golfers and the tennis players they reported with pain in the elbow joint. Radioulnar joint, superior radioulnar joint and synovial joint and middle radioulnar joint, fibrous joint, syndesmosis, inferior radioulnar joint, synovial joint. Now, এইটাই আমি বলছিলাম এই সিন্ডাসমিসিস কোন কোন জয়েন্টগুলো হয় আর সাইনোভিয়াল জয়েন্ট কতগুলো হয় you have to just once you get it in your head this then it will become easier for you to grasp the subject. Okay. Now, superior radialis is synovial, pivot variety, uniaxial. Articular surface, the circumference of the radial head, fibro-osseous ring, radial notch of ulna, and annular ligament. You will see all these components in your dissected body. You please see and identify. Once you see it, it will be there in your head. You be in the hall for 1.5 hours or 2 hours seeing specimens and also your book. Don't leave the hall. Don't leave the hall. And you see it will become easy for you to teach, learn. এখন ঢুকে গেছো পাইপলাইনে ফার্স্ট MBBS পাস করে ওরা ডাক্তার হয়ে গেছে তো তোমরাও ডাক্তার হবে ধরো গঙ্গা শুকিয়ে গেছে বিভিন্ন সময় সামারে এই বেনারস যাবে সেন্ট্রাল জায়গাতে শুকিয়ে গেছে তখন মোদিজি আর আদিত্য যোগীনাথ তারা টেন্ট বসিয়ে দিয়েছে জায়গাটা কত 1000 টাকা ভাড়া সেখানে টেন্টে মানে গঙ্গার মাঝে কিন্তু আবার যখন বর্ষা আসছে তখন চলছে কিন্তু পাইপলাইনে তুমি যখন ট্যাপ দিয়ে বন্ধ করে দিচ্ছ তোমার ট্যাঙ্কে জল আছে দেখবে টুপ 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 করে পড়বে তো ওয়ান্স নাও ইউ আর ইন আ পাইপলাইন you will be becoming a doctor anyhow by hook or by crook or anything but you will become.
Today our subject of discussion is prevention of disease. Now from the childhood we are hearing the proverb. What is the proverb? prevention is better than cure. Why? Cure means therapeutic treatment. It is being done after the disease occurs in a person. So, if a person is diseased, there is suffering, anguish, mental anguish, physical pain, cost of treatment, that is, money is required. He is invalid, bedridden, so man days are lost. তার ম্যান পাওয়ারটা নষ্ট হয়ে যাচ্ছে। His mental burden on the members of the family, কারণ বাড়িতে কেউ অসুস্থ হয়ে গেলে সবাই তাকে নিয়ে ব্যস্ত হয়ে পড়ে। It has a load on the healthcare facility, on the clinics, on the doctors. So if we can prevent any disease, all these problems can be alleviated. Now, to prevent a disease, some humming is there, please. For prevention of any disease, you have to know the cause of the disease. কারণটা না জানলে কোনো লাভ নেই। Source of infection. Third is dynamics of disease transmission. কি করে রোগটা ছড়াচ্ছে, যেমন কোভিড। আমার কোভিড যদি হয় তোমার কাছে কি করে যাবে? How it is transmitted to, it is called dynamics of disease transmission. Who are the what are the risk factors? Who are the risk groups? What are the prophylaxis? What are the treatment protocol? Etc. etc. You have to know to prevent the disease. I am giving you example. Next thing is, this prevention can be done in 4 levels. 4. 1, 2, 3, 4. First is primordial. Second is primary. Third is secondary. And fourth is tertiary. Now, what is primordial? Primordial কথাটা কি চেনা চেনা মনে হচ্ছে? মনে হচ্ছে? It is related something in embryology. Embryology পড়া হয়নি? So, শুরু হয়েছে. You will see this term primordial in embryology. That means here there is no disease, no chance of disease, but there are some risk factors. As for example, a large number of people in the middle age dies from coronary heart disease. It is the cause of sudden death. আমাদের বয়সী লোক বা আরেকটু অল্প বয়সের লোকরা হঠাৎ করে দেখা গেল মারা গেল। Why? Sudden death cause is coronary heart disease or myocardial infarction. কথাগুলো শুনেছো তো? শোনা আছে? So, what are the risk factors? কারণ তো আছে একটা, হঠাৎ তো মরলো না। তার কারণ কি কি? হাইপারটেনশন, হাই কোলেস্টেরল লেভেল, obesity, diabetes, tobacco smoking or tobacco chewing, sedentary habits. These are called risk factors. So, what are the risk factors? Number 1, we say WBCS factor. WBCS means it is a competitive examination. W means weight, overweight. B means blood pressure. C means cholesterol. And S means smoking, sugar, stress, sedentary habits. So, this is a mnemonic word. So, all these factors are called risk factors. So, this obesity, hypertension, diabetes, all these these factors starts from the early childhood. So, if we doing in such a way that the child will never be obese, he should not have any sedentary habit from the early childhood. অনেকে দেখবে, তোমাদের মধ্যে অনেকে আছে, নড়তে চড়তে চায় না, and they eating of Fats are of two types. One is good fat, one is bad fat. What is good fat? Yes. Yes. So, these saturated fatty acids are bad for health. This is the animal fat. অনেকে দেখবে সেদিন আমি গেছিলাম জামাইয়ের বাড়ি, তা মাংস কিনছিলাম, তো মাংস মশাই গেছিলাম, দেখলাম যে অনেক চর্বি দিয়ে দিচ্ছে, ফ্রি চর্বি, ভালোবেসে ওই দোকান থেকে নেয়। তো তা আমি আমার সান ইন লকে বলে, কি করছো তুমি, চর্বি নিয়ে কি করবে? বলে খাবো। বাট দিস অ্যানিমাল ফ্যাট ইজ, হি ইজ আন্ডার 40, বলে এখন তুমি খাচ্ছ, আফটার 50 কিন্তু বুকের মধ্যে চর্বি জমে যাবে হার্টে, and it is a risk factor for coronary heart disease. So these habits, those habits are very generated in the very early childhood. So in primordial prevention, we will not allow these risk factors to develop. So primordial, there is no disease, there is no risk factors, but we will not allow the risk factors to develop. So this is primordial prevention. Next stage, here the risk factors are present. That means there is hypertension, there is high cholesterol level, there is obesity. All these factors has developed. What is done in primary prevention? These risk factors are controlled. That is, hypertension is controlled by reducing the obesity. Obesity is related with hypertension. By reducing the obesity, by taking less common salt with food. অনেকে দেখবে 10 গ্রাম 15 গ্রাম করে দিনে টেবিল সল্ট খায়, NaCl খায়, কিন্তু আমাদের নর্মাল খাওয়া উচিত 5-এর নিচে পার ডে। কিন্তু ইউজুয়ালি ইন্ডিয়ানস টেক্স 5 to 10 milligram of NaCl per day. So it is directly related, this sodium is directly related with the causation of hypertension. So here the risk factor hypertension has already developed, but you will control it by taking less fatty food, by taking less sodium chloride, etc., by reducing the obesity. And there is high cholesterol level. You should, that is, it is more than different divisions, that is total cholesterol. Second is LDL, low density lipoprotein, HDL, high density lipoprotein, and VLDL, very low density lipoproteins, out of which HDL is good and others are bad. You have to keep your cholesterol level less than 210 or 20 per 100 milliliter of blood. So here you should take food which is not rich in cholesterol. Cholesterol rich food is কি? ডিমের কুসুম, egg yolk. So less. You please take less cholesterol rich food. There are other cholesterol. You will read it all in biochemistry. So this is not the forum to discuss about cholesterol. So you have to control your cholesterol level. If you cannot do by diet, you have to take medicines. Your blood pressure should be controlled. Your obesity should be controlled. If your blood pressure is not controlled, you have to take medicines daily. So what is the difference between primary and primordial? এগুলো question জিজ্ঞেস করা হয়. These questions are asked in orals. In primary, the risk factors of the disease has already developed, but in primordial risk factors are not yet developed. Okay, this is the difference. So in primordial prevention, we will not allow the risk factors to develop. And in primary prevention, risk factors has already developed. We will not go further to the disease process. Next stage, third stage is secondary prevention. What is secondary prevention? Here the disease has already occurred and you are taking action. So your question may be, disease has already occurred, how it could be prevention, isn't it? So, sir, you are telling it is a prevention, but disease has already occurred. How it could be, সোনার পাথর বাটি হয়ে গেল, রোগ এসে গেছে কিন্তু আপনি বলছেন রোগটাকে প্রিভেন্ট করা হচ্ছে। Yes, this is prevention. How? Already we have discussed the natural history of the disease, in which we have said that it has a pathogenesis phase. So this pathogenesis phase is again divided into early pathogenesis and late pathogenesis. I have discussed this on the beginning of this month. So here the disease is in the early pathogenesis phase. We will halt it. আমরা এখানে আটকাবো কাকে? The disease. Why? Because we will not allow the disease to go in the further stage. So what happens usually if we take the example of communicable disease? An organism enters into the body, it multiplies.